On May 24, one discharge pill challenged 80% of heart attack care because nearly 18,000 patients, a small town, showed almost no difference. You were told the pill protected the heart you just survived, but here is the catch. This only fits uncomplicated heart attacks. For everyone else, weaker heart pump function still changes the whole story. The old world made sense because heart attacks were deadlier then, and one 40-year-old trial became the habit hospitals kept repeating. Then stent procedures changed survival, while the prescription barely changed. So the pill stayed on discharge sheets even as risk fell. Now the newest data says the old protection may be missing. 8.1% versus 8.3%, basically a tie. Then the sex analysis hit harder, especially for women in this group. For men, the same harm signal did not appear in the data. And that is where the routine becomes a question again, because the first crack is simple. The old pill did not change deaths because nearly 18,000 patients split across trials, roughly a small town's worth, and the outcome line barely changed. 8.1 versus 8.3%. That is the part that should make you pause, because more than 80% leave hospital carrying that same prescription, and the cascade gets sharper when researchers separate women from men, because women on this pill show almost half again the death risk. Men do not show the same warning signal, which means the average result may be hiding a split audience, but this is only the careful group, uncomplicated heart attacks, where the heart pump still works at least half normal. People with weaker pumping can still need the drug, so this is not permission to change anything tonight. The real question is how that 40-year rule held on while the cost lands at home, not inside the hospital, because the pill becomes a daily proof that you survived, but the pooled analysis followed nearly 18,000 patients, a small town's worth, and the two lines ended at 8.1 versus 8.3%, meaning the old safety ritual suddenly looks less protective, especially when women hear the signal cut the other way, almost half again the risk, with no matching warning in men. Now the doctor has to say the hard part carefully. This applies when heart pump function stays at least half normal, because weaker pumps still need the protection this study left alone. Then the question moves from statistics to the kitchen counter, where a daughter counts bottles and asks what stays necessary, and a new follow-up trial says stopping roughly 5 years later can be safe. So keep your doctor in that conversation before changing anything, because the twist is not that the pill suddenly stopped working, it is that the world around the pill changed first. A 40-year-old trial came from a much deadlier era, when blocked arteries often stayed blocked much longer than today, so the drug had room to save lives back then. But in modern patients like this group, that margin vanished. The line almost overlaps after about 3.5 years, and for women, the signal bends the wrong way. Not every heart attack survivor belongs in that group though. If the heart pumps weakly, this pill may still matter, meaning the new answer is not stop, it is ask. So we return to the same discharge sheet, except now the safest move is a conversation first. Talk to your doctor before changing anything, because the next old habit is already waiting.